We have Dr. Sandeep Gupta to speak on smoking and CVD. What role for the cardiologist?
Thank you very much indeed, and it's lovely to come from London back to India and to see a number of friends and colleagues. Because of time constraints, I'm going straight for the conclusion. So the conclusion is that you cannot come to India and just talk about one risk factor. It's complete nonsense. You have to overlap and give an opinion on all the common risk factors, and the number one killer is coronary disease. And the conclusion from my point of view is 3 words: lower is better. Because if you think about your coronary patients, it's whether it's the LDL, the triglycerides, the waist circumference, the heart rate, the proteinuria, the sugar, lower is better. Now, some of you are worried about hypoglycemia and hypotension, so I've put lower, but not too low. You know who the best hypertension doctors are in UK? The renal guys, the nephrologists. They're very good. And do you know how the renal guys know they have optimal blood pressure in their patients? Is when the patient is just about to fall over, yeah? Just about. So your blood pressure of 119/75, you are better off than 140/85. And that's why the American guidelines have come lower is better. This slide is about 20 years old. And we knew in 1998, lower is better for LDL. There's nearly 40 studies, greater the LDL reduction, better the outcome. And we're still talking about how low to go. You see, who lives the longest in the world? Which population? The Japanese. A baby girl born in Tokyo today will live till 90. There are 35,000 people in Japan today over the age of 100. No one wants to die in Japan. Now, why do the Japanese, who smoke a lot, have low coronary disease and live long? 1 is their diet. And 2, look in blue here, their genetic cholesterol is low. And we've heard earlier how you need LDL for atherosclerosis. And in terms of the Japanese diet, you know how they eat? They eat 6 times a day, but they don't get full up. They eat small portion. Whereas in London and Mumbai, we like a buffet breakfast, buffet lunch, and a buffet dinner. But it's not as easy as that, because when they emigrate from Kyoto to Manchester or New York, the McDonald's effect happens and their risk goes up. Heart rate. Have you ever checked your own sinus heart rate? You know which animals live the longest? Camels and humans. And one thing is because they have lower heart rate. So we know the problem of cardiovascular deaths, and 80% are probably sitting in the developing and emerging countries. And so many people survive an MI and stroke each year. But there is not a single cardiologist on the planet that cures a patient from coronary disease. They all come back. My cath lab last Tuesday, 8 angiograms, 6 of them were previous bypass and stent patients. You know how miserable it is to do a ward round in the emergency department, coronary care. We see the old faces. Our OPD is full of follow-up. So when you have a patient who's had an MI, stroke, or peripheral vascular disease, their chance of further MI and stroke is 5 to 10 times greater. And the message? Lower is better. So Salim Yusuf from the Interheart study told us how whether you're sitting in Dhaka or Atlanta or Melbourne or Johannesburg, 80% of the world's MIs are explained by 4 risk factors: diabetes, cholesterol, blood pressure, and cigarettes. And he found in the Interheart study that smoking was accountable for nearly 40% of the attributable risk for first MI. This is a horrible picture, I apologize. It's from the internet. If you were to have every effect of tobacco, this is what you would look like. So it's not just cardiovascular disease, it's every part of the body. And this I'm not sure how many of the public are aware that one cigarette has 4,000 chemicals, 80 of them are carcinogenics. So a cigarette contains vinegar, sewer gas, poison, road tar, rocket fuel, nail varnish, etc. And these are the cancers, and there's varying degrees of attributable risk that are linked with cigarettes. You know, I said the conclusion is lower is better. For cigarettes, it's not lower is better, 0 is better. You know how long ago did they realize the link between tobacco and harm? You know how far back it goes? It's about 150 years ago, 1848, that they discovered delirium linked with the adverse effect of tobacco. So every minute now, 8 smokers die. And it's not just the deaths, it's the morbidity. And if you look at the leading causes of death in the world, of the top 8, cigarettes are linked with 6 out of 8. And if you look at which parts of the world are smoking, around 50% of the world's smokers only live in 4 countries: Russia, Indonesia, India, and China. And if you look at various parts of India, there is a gradient or there is a disparity, and certainly in certain parts, like in the east, higher rates of tobacco. And it's not just cigarette smoking, it's other forms of tobacco. So if you look at coronary deaths, today is 22nd of February, by midnight in India today, 400 people will have died from a coronary. But by the end of today, 3,000 would have died related to smoking, not just coronary disease. And so, how many new smokers every day? Again, obviously it depends on the population, but in India they estimate about 4,000 new young smokers. So we've done well with post-MI care, and throughout the Congress I know there was plans to have so many aspects of the benefits that cardiologists and clinicians have done. Everything from primary PCI, statins, ACE, beta blockers, 20-30% reduction. And if you look at after surviving a heart attack, if you get no secondary prevention, your death rate is high, 8 to 10% a year. But if you get the right cocktail, your secondary prevention, everything goes down, and you want to leave after your MI 2.3% risk. You don't want to leave at 8% risk. But if you stop smoking, let's say you're a smoker after your MI, the benefit is as good as your atorvastatin or your clopidogrel, as good as. And this is just the meta-analysis showing that data. But you know, the public are fed up of listening to our advice. And I remember going on the radio, and a patient came on the radio and said, "Dr. Gupta, I'm fed up of listening to you. You keep saying, do this, don't do this, walk this, stop eating this." He said, "When your time is up, your time is up. Leave us alone." And you know what I said? I said, "Mr. Khan, in the year 2019, it's very difficult to die. It's very difficult to die. But what is easy, if you don't stop smoking, take your blood pressure tablets and have your checks, you'll need your leg amputated. You'll need an oxygen cylinder to breathe. You'll need your 3rd bypass." So you tell your patients, it's not just survival, you want healthy years of life. You see, if you carry on smoking, your disease progresses. And this is even after you have a bypass. That if you look at data, smokers after a bypass, they have a greater risk of coming back for their redo bypass. And even after stenting, there's evidence, and we see this in the cath lab, the thrombosis, restenosis, often they are smokers. And there is no lower limit for smoking. Even a handful a day is enough to trigger an event. So the question then becomes, the main ingredient of tobacco is nicotine. Is nicotine innocent or is it harmful? There are a variety of mechanisms, whether it's atherogenesis, is it plaque rupture, platelet activation, inflammation. We've heard from Dr. Lahiri about inflammation. All these factors can come into play, but also a sympathetic drive, tachycardia. And do you know why They banned cigarette smoking in hotels and restaurants and train stations in the UK and parts of Western Europe because the non-smokers, you and me, we were fed up of dying related to smoking, second-hand smoke. And it's lovely to see there is now, even in this part of the world, evidence of cutting back on public smoking. So this is a non-smoker, died crossing the road. This is the post-mortem of their lungs and heart, clean. This is a smoker. And you just see visually the difference. And then we have this poster in our clinic, in the cardiology department in our hospital. And this is a slide you will always remember. You will never forget this slide. For every one cigarette you smoke, you will lose 11 minutes of your life. And every time I give this slide in a lecture, I see people adding up. How long have I got left? How many are needed to cause a heart attack? Maybe just one, if you look at some data. The reason is that if you are vulnerable, it's like a bottle of whiskey a day is drunk by 10 neighbours, but only one will get cirrhosis. And it's a bit like caffeine. My wife has a cup of coffee at night, she can't sleep. I sleep with the coffee, no issue. So people may be vulnerable to tobacco. How quickly, is my time up? How quickly does a cigarette cause harm? Within minutes. If you look at the evidence of just taking a few puffs, endothelial cell damage, free radicals, and it's like a glass of champagne. You know when you have a glass of champagne, the bubbles go straight to the head. Instant. How does a cigarette cause harm? Similar mechanisms as the nicotine, but also carcinogenics. Last couple of slides because of time. You have 1,000 smokers, 20-year-olds. How many will be murdered? It depends where you live. Maybe 1 in 1,000 20-year-old smokers will be murdered. You have 1,000 20-year-old smokers. How many will die in a road traffic accident? It depends where you live. But maybe 6 in 1,000 20s. And finally, you have 1,000 20-year-old smokers. How many will die in middle age, not old age, from cigarette smoking? 250, just to give the impact. But turn it around. We have a habit of telling our patients off or scolding them. Why are you overweight? Why are you drinking? Why aren't you eating dried fruit and carrot sticks and eating samosas? We tell them off. But if you turn it around and tell them the benefits, it may have more impact. And if you stop smoking, and especially from the words of cardiologists, who can be quite influential, you can tell them within minutes, days and hours and years, everything will improve. Your skin will improve. Your taste will improve. Your tachycardia will come down. You can open your lungs. By 1 year of ex-smoking, you've halved your risk of cardiovascular disease. And by 15 years of ex-smoking, you're like a non-smoker for heart disease. Every day of stopping is worth it. The thing is, how do we get patients to stop? And you need the support. You need counseling, you need medication, pharmacotherapy. And remember what Mark Twain said? Stopping smoking is the easiest thing to do. I know because I've done it thousands of times. Remember that because of addiction, you need special pharmacotherapy. Whether it's bupropion, NRT patches, and if you have a trained team, give them Champix or varenicline. 3-month course can improve the outcome of total smoking cessation. I would have liked to carry on, but because of time, it's not fair. Thank you very much for your time.
Thank you, Dr. Gupta, for your outstanding presentation as usual. We in India, we have chewable tobacco also here, and BDs also. You know, these are local. They are equally harmful. I mean, a lot of data is there in that chewable tobacco and all this. I think that's increasing in India. Would you like to comment anything?
Yes, it's a good point, Dr. Manchanda, because basically all forms of tobacco has to be put into one group. It is harmful. So whether you chew, whether like in Sweden they have snus, whether in like Egypt they have shisha pipes, and even the latest trend is e-cigarettes. Not so big in India, but we have, in my high road, they have now just opened a 4th vaping shop. It's as common as a hairdresser. And the thing about vaping, it's tobacco, there's no long-term data, and they're disguising it as cappuccino or blackcurrant flavour, so teenagers don't know it's harmful. So whilst it may be a good tool for smokers, it's creating a new disease in America and some parts of Europe.
And Dr. Gupta, I'd like to also point out that in India, we are exposed also to what I call silent tobacco. And by this I mean that 20% of the dental powders sold in North India have a significant amount of tobacco not mentioned on the label.
Wow.
And they, because of the tobacco's anesthetic effects, their dental pain goes away and they feel very happy. They're without going to the dentist, they're fine.
It works.
Not knowing what's happening.
It's like steroids, isn't it? You wipe out eczema, asthma, your rash, and you feel high.
Yeah, environmental pollution in Delhi is so bad in many parts, which is equal to smoking 10 cigarettes a day.
I heard that.
So that's another problem we have.
Anyway, we'll talk outside.
Thank you
next
telling that it is the biggest terrorist in this world and we should stop it. Thank you.
So may I request the chairpersons to present the memento and certificate to Dr. Sandeep Gupta.